there's this very persistent gap in birth outcomes between Black women and other women in the United States. And that difference is there for even highly educated women or women who are relatively well off. So it's not only a function of the fact that women of color are more likely to have low income, but it seems to be something else. Black women are more likely to live in neighborhoods where there is this kind of violence. And, that's a very persistent feature of the United States, that we have a lot of segregation in terms of where people live. So, Black women are more likely to live in these neighborhoods. They're more likely to know somebody who's subject to gun violence, and they may just have higher levels of stress because of that all the time. And so showing that that kind of stress is related to low birth weight and prematurity, which is much higher. So, Black women are about twice as likely to have an infant that's low birth weight. And so it could very much be related to this kind of stressful environment, which is just not a good environment to be pregnant in.
We have so many of our women who they don't have health care, so they're not going to the doctor regularly. And so that means when they're pregnant, we're learning that they have hypertension and underlying conditions that they didn't know before. And so all of these factors, and specifically the big one that I focus on as a doula, is the stress, is the hypertension, because we've also had scientific studies that have shown that that is a really, really large percent of why a lot of women are miscarrying and losing babies and having issues in childbirth. So Black and brown women, we need more support. The numbers don't lie. The statistics are there. And so we just need to do more work in the community. When we're talking about stress, we're really talking about trauma. If a mom is stressed, that baby feels stress. And so it affects us in ways that sometimes as mothers, we don't really recognize. So when we're talking about gun violence, what we don't factor in is the mental health conditions that a lot of our moms are already dealing with. So when things come up that are not planned, like mass shootings, on top of economic factors, food insecurities, you're really piling a lot on the plate.